They rode through the tunnel from Belgium, not on horseback, but in articulated lorries. At some point today, maybe in these very vehicles, the cavalry arrived in the UK, bringing nearly 1 million doses of vaccine. As they were driven to a secret location, government scientists toured the studios to reassure us it's safe.
Absolutely no corners have been cut by the MHRA in their assessment of this vaccine. And we've completely left them alone to do all the same assurance steps at their own time, just as normal.
The first batch of Pfizer-BioNTech vaccines arrived today. They are being taken to a secure Public Health England depot and further checks will be carried out. It will then be distributed to 50 designated hospital hubs across all 4 nations. And the first vaccines will be given on Tuesday. Scotland will get 65,000 doses, many of which will go to care home residents. Its government has confirmed with the regulator's approval it can be moved and split into smaller batches.
Both of which makes this vaccine more usable with minimum wastage for care home residents and for our older citizens. So in effect, we can take the vaccine to them or close to them, and we will begin that exercise from the 14th of December.
That's not yet the case in England. Under pressure to get the vaccine to care homes, the NHS is working with transport companies to try to resolve it. Residents had been told they'd get it first.
They are the most important, and we still hold by that view. But we do understand that there are logistical difficulties, and as soon as those are surmountable, those care home residents will be in front of the queue.
Until the NHS can transport it safely, hospitals have been told to vaccinate their inpatients who are over 80 and care home staff, but only those who can return 3 weeks later for a second dose.
If we can't use all of those vaccinations for those groups, then clearly we would want to use them for NHS staff. But I think the expectation is that the vast majority of NHS staff will probably be done early in the new year as opposed to before December. But it depends upon when the vaccine doses arrive.
The challenge to get this vaccine has been enormous. The next is the logistical one, getting it into millions of us. We are the first country in the world to try it. The rest of the world's eyes, then, are on us.